Hi guys, welcome back to another episode of What in the Nursing. So today we'll be discussing nephrotic syndrome. So what is nephrotic syndrome? Nephrotic syndrome is a kidney disorder that is caused by damage to the glomerulus membrane, causing leakage of protein into the urine. So what are the types of protein that we lose? One, we lose albumin. This is the main protein and it regulates our osmotic pressure. We also lose immunoglobulins, which prevent infection, and also anticoagulant proteins, which prevent blood clot formation. So what really happens in nephrotic syndrome is there'll be damage to the membranes. Once the membrane gets damaged, there'll be increased permeability to the protein, hence the protein leakage. So we will lose our immunoglobulins, our albumin, that is the main protein, and also our anticoagulant protein, that is antithrombin 3. Once we lose our immunoglobulins, the patient will be at risk of developing infections. The loss of albumin also results to a decrease in the osmotic pressure, hence the patient will present with edema. So the liver also tries to compensate for the lost albumin by making more albumin, but it also makes more cholesterol and triglycerides during that process. Hence the patient will have increased cholesterol and triglycerides levels. The patient will also lose antithrombin 3, meaning they'll be at risk of blood clot formation or thrombosis. So what are the signs and symptoms? We can have edema, where there'll be excess fluid in the body tissues. This edema can either be in the face or periorbital region, especially in the morning, but it can also be in the legs, the ankles, the labia, and the scrotum. We'll also have proteinuria. The urine will be dark and frothy. Patient will also complain of fatigue, lethargy, loss of appetite, and they might be anorexic. You will also get elevated serum lipid levels, that is hyperlipidemia. What should you do as a nurse? You should give them a low sodium diet because sodium holds on to water, and if you give them more sodium, there'll be more swelling, more fluid retention. Patients should also be on a high carbohydrate diet because it will improve their energy and prevent further breakdown of the proteins. So the diet should have moderate protein because too much protein increases proteinuria and strains the kidneys even more. Too little protein worsens the hypoalbuminemia and might cause malnutrition and muscle wasting. You are also expected to monitor the input-output, monitor the weight, assess the edema, assess the abdominal girth just in case the patient might be developing ascites, give meds, prevent infection, and monitor the vitals. So what are the treatment options? We'll give corticosteroids to help with the inflammation, diuretics to get rid of the excess fluid, statins to control the hyperlipidemia, plasma proteins to increase the osmotic pressure, and prophylactic low molecular heparin to reduce the risk of thrombosis. Thank you guys. See you next time. Don't forget to like, comment, and subscribe. Bye bye.